I'm going to be sharing this presentation with my colleague Rachael McIlroy from the Royal College of Nursing. What I wanted to start with was talking about the gender pay gap in the UK, which according to Eurostat in 2017 was at 21%. We know this, but what we haven't really been talking about today is another aspect of pay and earnings in relation to equality, which is the gender pension gap. And if we look at Eurostat figures for 2018, that is 34%. And I think it's always worth thinking about not only the gender pay gap on its own, but also in relation to other aspects of pay and earnings, because in many ways, the gender pension gap represents the impact of discrimination and inequalities over a lifetime. When we talk about the gender pay gap, as we know, it is either the median or the average pay on an hourly basis, but it doesn't actually represent the extent to which some people in society are completely missing out, and the extent of the gap is just over not only what we have in our pockets on a monthly or yearly basis, but also what we will end up with, and how that might have consequences later in relation to poverty, violence against women, etc. I think talking about the gender pay gap and equal pay is something that is quite important and raises a number of more fundamental questions. And some of the ones that I wanted to start thinking about as we are closing this conference is, for example, how does the gender pay gap relate to different degrees of feminizations across professions? So this is about looking at it from a cross-sectional, so this by which I mean just across different types of profession, but also over time, just how have professions become, has pay becoming lower or higher in different professions. And for this, the work that we've been doing in the health sector, and particularly nursing in the UK context, is very interesting, and it's extremely relevant when we are facing this COVID-19 crisis at the moment. Some of the questions that we might want to think about is, for example, is the feminization of the medicine profession linked to a drop in pay? Why is it that as doctors have become more and more women, this has been just associated with just a drop in status and of course in earnings? And is pay in nursing low because it's a profession that is largely dominated by women? And 9 in 10 nurses in the UK and more generally are women, and this is just something that is very, very problematic, and we will show this in a second. I'm just going to show you some very, very brief results from a much wider study that I've been conducted at Oxford Brookes University with colleagues and with Rachael McIlroy from the Royal College of Nursing, where we've been looking at pay in the nursing profession and also some looking at working conditions. And what's been very interesting about this study is that we've been looking at the gender pay gap in healthcare generally, but in nursing more specifically. And what we found is that in nursing, we don't have a gender pay gap as such. But we're not saying that this means that there is no gender issues at all in nursing. Instead, what we conclude is that even though there is no gender pay gap in nursing, it means that women and men are paid equally badly. It's very noteworthy to see that the average hourly pay in nursing is just £15 per hour. And when we actually see that these are some of the workers that are in the front line at the moment, it is something that I personally find absolutely shocking, and which I think calls for an urgent reevaluation. This said, we don't see differences if we measure the gender pay gap on an hourly basis, but if we actually look at it on a weekly basis, and going back to my point earlier about thinking about what this means in our pockets at the end of the month, but also just at the end of our working lives, what we see in nursing is because of differences in working hours between women and men, we do have differences in earnings. So this is just one of the graphs that we have in the report that we have recently published in January, which shows that, for example, on a weekly basis, earnings for women in nursing are at about £490 a week compared to £585. So a significant difference of nearly £100 a week. So at this point, I'll hand over to Rachael.
Hi, yeah, I'm not going to go over too much the results of the report. You can read that online. There are many findings and analysis in there. I just wanted to take the opportunity to put the report and to put our findings in the context of COVID-19. Everybody today has spoken about the spotlight that's been shone on the health sector, and particularly the social care sector, and the undervaluing of care roles. Taking our report, the findings of our report, and putting them in this COVID spotlight, we see that the crisis has really highlighted the range of tasks that nurses and nursing staff do that's perhaps not been as visible as before until now. That nurses are right at the heart of healthcare. That they're at every stage of healthcare, from testing through to critical care. They're out in the community as well as in hospitals. They're in physical care and in mental health. We've seen the testimonies from nurses over this crisis about what they do, the skills that they contribute, the safety critical nature of their job, but also the risks they face day to day, not just in terms of the catching the virus, but the consequences of speaking up. We've seen that nurses have been reprimanded many times over speaking up over PPE shortages, and that's not new. That they don't feel they have a voice to be able to speak up within the workplace. We've seen the impact of nursing shortages. There just simply aren't enough nurses. There aren't enough care staff, and this in turn leads to an over-reliance on bank and agency staff. So hopefully this leads to nursing roles being more visible, and a re-evaluation of the nursing profile, the nursing profession, and the rewards that nursing professionals receive. So for unions like my own, beyond dealing with the kind of immediate impact of the crisis, dealing with the physical and psychological needs of the nursing staff, and trying to get them through the crisis, we'll be looking beyond this to look towards a better future, to try and unpick some of the inherent problems within health and social care and the working environment, and build a kind of build a better future for nursing and care staff. When we think about pay, when we look at talking today about equal pay, when we talk about pay, though, I think what we come up against, which we talk about in the report, is a kind of underlying unease or cringe even amongst colleagues I work with at the RCN, about really talking about pay, talking about value and worth. Even when, at the moment, when there is a clear need for a well-educated, skilled and well-rewarded staff, there's a real hesitancy amongst the nursing staff and even amongst RCM staff about sort of the dirty talk of pay. And I think that's a real obstacle we need to demolish. But the optimist within me, lots of people today have spoken about building coalitions to a better future, advocating for new solutions, tackling the undervaluing of women's work within broadly and within health and social care, and looking at wider structural issues, looking at health inequalities, looking at the importance of investment in public health, in investment in mental health, and nurses are at the heart of those provision, and hopefully at the heart of that, of talking about that future. So please read the report. There's a lot more there. I just wanted to put that in the context of COVID-19. Thank you.